Okay, so Dr. Sol Cogan, you are in the house.
I'm here.
You are here. You are here. So thanks so much for joining us. So tell me, okay, the Nerve and Disc Institute. Back.
Back, neck, sciatic pain.
Okay.
We treat people that have severe back or neck problems or sciatica as a result of herniated disc, bulging disc, degenerative disc disease, or stenosis.
Mhm.
Traditionally, these problems, if you had one of these problems, you really only had a couple options. One is to live with it.
Okay.
You know,
Deal.
the problem with living with it, besides the pain, is it's degenerative.
Okay.
Second option is to manage it. A lot of ways to manage it. You can
Okay.
take anti-inflammatories, painkillers, physical therapy, chiropractic, acupuncture, massage, epidurals, high-dose laser. And any and all these things can help you feel better for a short time or a little bit longer. None of them are going to do anything to repair the disc. They can help you feel better, but it doesn't fix the problem.
Okay.
The only corrective option that was widely used up until about a decade ago or so was surgery. The problem with spine surgery is it doesn't have a great success rate,
Mhm.
and it always leaves the spine less stable than it was. So we've come up with technology that's proprietary to us that actually repairs those problems
Right.
and
I'm looking
allows
for the name. Is it Spine Force?
well, no,
Or is that
spine force is the new thing.
that's the
So,
new thing?
so
Okay.
intradisc neutrosis is our process that we use to repair discs. The machine is called Dislogic, and it's proprietary to us. And then
Okay.
actually, we can see pre and post radiographic or MRI changes.
Mhm.
We had a clinical study done in 2015, done by an independent researcher that showed better than a 95% success rate.
Wow, that's
Yeah,
amazing.
so-
And I know, I mean, like my sister-in-law, I had have hip surgery and sciatica and all. I mean, it affects the way you live.
It is horrible.
And of course, you had your own issue,
Oh my
right?
God. Yeah.
Which
You
is why
have
I paired you and Paris together because Paris is a director, a producer, but one of his documentaries was about his own illness.
yeah.
You know.
Yes. Oh, that's right. You're
Yeah,
his guy, aren't you?
I know Paris. I was thrilled to see him. He's a great guy, but yeah, I know firsthand. I mean, I had some problems years ago that we probably don't have time to talk about.
Right.
But last 2 weeks in August, I was skiing in South America with my son,
Mhm.
and we were backcountry skiing cliffs. And he corrected me the other day. I said 20 foot. He said 15. But
You
anyways,
know.
we're jumping cliffs, and I'm walking and I felt a pop in my back. And unfortunately, I know too much. And I knew right then when I felt that pain going down my leg, I had a herniated disc. And thank God it was the end of the trip. I only had
Okay.
3 days left, but I didn't sleep for a week. Came back here the day before Labor Day, day after Labor Day, started treatment. And within a few weeks, I was 60% better. I mean, as opposed to surgery was
Mhm.
what I would have thought of. I would have done anything at
To
that
get rid of
time.
the pain.
And then I had to think of a way, what do I do to make sure this doesn't come back again? Because my son has big ski aspirations and I want to be there with him.
Mhm.
You're talking about guilty parent.
I know,
I want to be
right?
there right with him. And so I'm going to continue to jump those cliffs and ski backcountry with him.
Right.
And I have to be able to do things that I tell my patients not to do.
Mm.
So we did some research and brought in a device called Spine Force from
Very.
France,
Okay.
which is a really unique machine. It's a three-dimensional dynamic trainer for spine.
Mhm.
And it actually is the only way we found that you can strengthen the 180 muscles that support your core and spine in a dynamic way with real-time feedback. So, if I told you I'm 9 weeks out from my injury, if I told you I'm 100% better, I'd be lying. I'm 110.
Really?
I feel better, faster, stronger than I did before. And the nice thing about this machine is it's only a few minutes, a couple times a week, and it creates imbalance so you can strengthen these muscles and some muscle memory with your brain.
Mhm.
And the idea is to make it so you can fix the problem for a lifetime.
Okay. Well, you're up and running around and doing
Uh,
good, huh?
A week from Wednesday, I'll be in Utah skiing. So, and if you asked me that 3 months
You'd be like,
ago,
no, it's not
I
happening.
would be like, I don't know if I'm ever going to
Park
ski
City?
again. Park City.
Oh, see, I guess so, huh?
Yeah.